So good morning, everyone. We're here at Johnson College in Cornell University. We're about to start our tea time. Today we have two guests. One is Rohit Verma, Dean of External Relations of Johnson College at Cornell University. And the other one is our graduating MBA student, Karthika. And we're going to talk today about healthcare and emerging markets.
So thank you, both of you, for joining us. It's a graduation week here at Johnson Cornell College of Business. We are delighted to congratulate Karthika and her classmates for an excellent MBA. You are going to Deloitte in a few days. And before that, you have been doing a lot of work on healthcare. And the Dean of External Relations, Rohit Verma, is also the director of a very important institute about health and well-being here at the hotel school. So we cannot think of better two speakers to discuss this very important topic. Healthcare is a major industry here in this country and is a major concern in many other countries, always in the news. So Karthika, please, let's start the conversation on the challenges and opportunities of healthcare in emerging markets.
And thank you so much, Professor Verma, joining us here today. If you can give us a little bit about your background, that'd be great.
Sure. So first of all, thank you for the invitation. It's my pleasure to be here, and thank you everyone for watching. I hope you get some value out of our discussion today. So my background, I grew up in India. I had my undergraduate degree in engineering, and then I came to United States to study engineering and eventually got a PhD in operations management. My focus has been service sector, how you can use operations principles to improve services. And over a period of time, I have started doing more and more work with hospitality, retail, and then more recently on healthcare. These look like different industries, but they have a very common theme, which is each of these industries are built around one person taking care of another person in need. Sometimes in a positive situation, maybe somebody going on a vacation, or going to hospital to pick up their new baby, or sometimes in a stressful situation like an important business meeting or surgery or something. So here at Cornell, we have initiated a new institute called the Cornell Institute for Healthy Futures. It's a joint effort between the Hotel School and College of Human Ecology. This institute links hospitality and health and wellness together because these are some of the big issues all around the world in emerging markets and beyond. So,
thank you. So today, as we said, our primary focus will be in emerging markets. And one of the things that we wanted to understand is what are some of the trends that you have been seeing across various emerging markets across the globe?
Sure. Yeah. So we cannot think of all emerging markets as one, first of all. And so there are different trends we observe at different places. One big trend, I would say, is that in all around emerging market is that people are living longer and people are living longer in a healthier state and they're a little bit more prosperous. So as a result, the human age of Earth is increasing every year, which means that in 10, 15, 20 years, we'll have a lot more seniors all around the world. And the proportion of seniors will go higher in developed world too, but the rate of growth is much, much higher. In places like China, for example, in 20 years from now, there will be 325 million people over 65. That's the entire population of the US above the age of 65. So that's one big trend. It should have a huge implication for healthcare, but also the society. Other trend is in many countries the birth rate has gone down. So you look at places again, China, because of their one-child policy for quite some time, but also in Korea, in Singapore, India, the number of children per senior is a lot less. And so there's a need for some type of professional setup to take care of older seniors. And healthcare is a big part of what they do. Some other trends I can think of on a positive side, we have many type of technologies available now. both for a clinical part of care, but also non-clinical aspect of care. So many machines, such as MRI machines and so on, they have become smaller, and so they require less power. They are more robust, so you can take them to villages for checkups and so on. But also, technology like smartphone that allows people even in remote areas now to be able to access medical advice and doctors and keep track of how things are progressing. So it's quite fascinating how these trends are emerging.
Have you also noticed challenges that are in almost parallel to these trends? So there's a lot of progress based on what you have just spoken, but also what are some of the challenges that you're seeing, especially in terms of accessibility to healthcare, whether it is small devices or other means?
Well, some of the challenges continue to be age-old challenges, right? Which is, the emerging markets typically have less purchasing power. And so whatever the latest medical devices are, or medical procedures, or latest drugs or medicines are out of reach of a large number of people. And now if you compare the access to care today from 50 years ago, yes, of course, there's more care available in emerging markets. But if you compare, let's say, United States to India or China, and you look at, to make a direct comparison, you will see that the more developed markets has more access to technology and high level of resource. So that continues to be a challenge. Patent laws, for example, and the huge cost of development of drugs make it very hard for companies to immediately offer low price products, but at the same time, if they don't charge money, their companies will go bankrupt. So it's a very hard problem, and we continue to wrestle with that.
Absolutely. It's you were mentioning about patent law. So some of the governments, what they have been doing is not really following and having more of a generic product in the market. Do you think that's a good way to go forward?
I mean, if there were an easy answer, somebody would have, you have solved it. But yes, that is the issue, right? I mean, on one hand, we have to be able to protect the rights of individuals and companies who have invested billions of dollars to create this new drug, right? The cost of one new drug is $1 billion, if I'm not mistaken, and a 10-year development time. So they need to get the benefit. But the other side is the benefit which provides to the citizen. So I think it's not a 0-1 type of situation. I think government can play a big role. If large countries with large populations, such as again India and China, will be great examples of that. If government can create some type of huge incentive for companies who have patented drugs, so that they can legally deliver their medicines to masses and get major discounts in taxes or something else, then that could be a way. Because otherwise, the alternative is that we'll have a black market for drugs, and nobody benefits from that.
Yeah. So I got a couple of questions. One, I was thinking of the Bill and Melinda Gates Foundation that is doing this tremendous job in Africa to eradicate malaria, sometimes with simple things like mosquito nets, and that are being distributed all over. That's a very old technology, if you can call it that way, so that to prevent malaria and to eradicate malaria, that is still very important. So how do you think these foundations and NGOs do make a difference?
Yeah, that's a great point. I think large foundations like Bill and Melinda Gates Foundation can play a huge role, much bigger role than government, clearly. I think the key here is preventive measures, right? I think mosquito nets, if you have mosquitoes, that's a great example. It prevents people from getting the disease, and therefore you don't have to spend so much time later to treat the disease, right? And fortunately, around the world, there is a movement towards preventive care, which includes not just prevention against disease, but also better and healthier lifestyle. So, ancient methods such as yoga and meditation and acupuncture and using herbs and natural products in food, these are becoming bigger part of healthcare discussion. I think how foundations can help is to promote this message. I think if they are able to let more and more people know about better way of living, then I think, which includes, preventions like mosquito net, for example, then I think conversation can go away from healthcare equal hospital or healthcare equal medicine to having a healthier lifestyle.
And one more question, and then I would like to ask, in our tea times, we always bring opinions from younger students, from Karthika and then Thomas. So a couple of things. One major problem here in the US, of course, is obesity.
Yeah.
And guess what? Now we have Mexico, an emerging market, where obesity is prevalent. Is the country with the second highest concentration of obesity per percentage of the population with obesity in the world, with all the problems of diabetes, etc. So how can we prevent emerging markets that are not there yet with these problems of obesity? In India, the problem is not that prevalent. Of course, in China, much less. In Africa, much less. So what would be your advice to prevent things like obesity to become a problem and to be a problem definitely for healthcare systems in emerging markets?
So I think emerging markets they have an advantage in this case. They can learn from the mistakes made by the developed world. If you look at North America, mostly US, after the Second World War till about, say, 10 years ago, the fast food industry rapidly grew. And fast food is typically equated with companies such as McDonald's and others. Some get more press than the other. But basically, the idea is that you create cheap food, industrial production, which is really not good for you, right? And because it's so cheap, then more people consume that. Drinking beverages which are not natural, so soda pop of various types, which are full of sugar and so on. So we have seen that it led to the problems today in more developed economy. What we are seeing is as more multinationals go to emerging markets, in a way, similar things are being done 50 years later in these areas. I think we have an opportunity to stop that from happening. I think the best way to stop obesity or anything else is to really make regulations harder for companies who are not following a healthy, not promoting healthy behavior. They shouldn't be getting a lot of discounts or tax benefits, and the ones who are doing should be getting more. Your earlier point about foundations, again, they can do a great job in trying to mobilize people and talk about healthier diet and so on. That may be a slower way, but that's more effective way, in my opinion. I don't know what you all think.
Yeah, I definitely agree. I also think that there's a huge opportunity, just like how you were mentioning about the foundations and other NGOs working. Education is a key aspect of it. At grassroots level, it makes huge changes, and that it should be something absorbed. The government should be absorbing as well along the way. That's my opinion.
So as for me, I would like to say, the NGOs and the foundations, I think they help, like you said, but I think sometimes they focus on the short term. So maybe the nests, for example, as you were saying, they solve the problem for now, but then they don't eradicate the disease, So maybe it's better if they focus on the long run, like for example, better regarding health, like a better lifestyle, like with a diet low in carbs and low in fats or whatever. So I think foundations and NGOs, they help, but sometimes they focus not on the long run. So they need to change the focus. And then regarding emerging markets, I think it's in every country is so different because healthcare is provided in such different ways. So I don't know how easy, I don't know what you think about how like in every country is so different. In many it's like state provided, or in many it's private. So if it's private and people don't have a lot of money to pay for it, so I don't know how it's gonna work.
Yeah, so I would like us to think about healthcare more broadly than just sick care. Right, sick care is when somebody gets sick and you go to a hospital and you're worried about who's paying for it. That's what it is. But if you think about health more holistically, then a lot other things come into this. That will include the healthy lifestyle, movement, outdoor activities, even the environment plays a role. There are cities where we have heavy industrialization. A lot of those are in developing part of the world, where the environment makes people sick, and then you have huge cost to society because you have to now take care of it. So I think the conversation has to go away from sick care to healthier life.
So it's more like lifestyle, I would say.
It should encompass more of a holistic outlook for how healthcare is tracked across from beginning all the way to aging population.
And I think that affects also obesity, as you were saying. So instead of like operating someone because they're obese, it's better to just treat them like, like have a better lifestyle throughout your entire life.
Right. To build on your point, wouldn't it be nice to stop obesity happening in the first place so that you don't have to go and surgery? Maybe somebody has medical condition. We're not talking about special cases, but which could be prevented if you could put right systems in place. Then I think that'll be a worthwhile achievement.
So I will ask one final to you. Have you seen any trends where any countries from the emerging market, what we identify as emerging markets, embrace that early on already, or is it something that needs to be a change that is made in the future?
So I think the good trend is that many countries who had stopped relying on the traditional wisdom are slowly rediscovering them, if you will, right? So, the yoga, the meditation, acupuncture, not eating only protein, animal protein-based diet, they are becoming more and more common again in many parts of the world. And I think that's a healthy sign. So I don't know if I can single out one particular country, but it's generally speaking, the younger generation is a little bit more careful about these issues all around the world.
I would say that we should keep on promoting, as you are saying, healthy lifestyles, traditional, yoga. I was in Brazil last week, and in a remote area, and in the beach, there were a couple of women doing yoga. So yoga has been one of the major exports of India, and is definitely promoting healthy lifestyle. If you are able to do all the yoga movements, you are healthy, let me tell you. Then basic things like drinking healthy water. So keep the water clean and drink water. And then I would say we are in a business school. So I think all the fast food companies, the fast food companies did not start about the idea of not promoting healthy food. But the question was that maybe along the way something has happened that definitely they are part of the problem, but I am sure they want to be part of the solution. So we should call also on the behavior, on the ways of working of fast food companies promoting health food. You can have fast food that is healthy as well, and of course the soda companies that are major multinationals, promoting as well drinking of water, drinking of healthy juices without sugar. So healthy habits that will hopefully avoid the problems that we are having in Europe, on the US, obesity, and definitely lack of walking, lack of exercise. So definitely emerging markets can learn and prevent the problems that we are having. So thank you all. We'll have again a closing tea time tomorrow, where we will be talking about technology and emerging markets and cryptocurrencies and all the latest trends in technology. And I thank you all. Thank you and congratulations, Karthika and Nair, for your MBA and having a wonderful career ahead of you in healthcare and beyond in consulting. Thank you very much, Dean Rohit Verma, for the wonderful work you are doing, because we need more thinking and more forward thinking and more ideas on the healthcare, because it's suffocating our budget. So we need good ideas to make it lighter. And thank you, Tomás and Nicolás, who are here from Universidad de los Andes and spending an internship. Nicolás Clavijo and Tomás Merizalde starting their internship here at EMI. And we look forward to continuing working with you all. Even after graduation, Karthika, you have to keep in touch. Thank you very much.
Thank you.
Thank you.